Good afternoon, dear colleagues. My name is Amir. I'm pharmacist from Portland, Oregon. I'm first-year PhD student at the Department of Pharmaceutical Science, Semmelweis University. And my supervisor is Dr. Deju. And my SMS is Ghana. My vision is to improve the quality of life of patients suffering from chronic diseases. And my mission is to support evidence-based use of natural products my clinical question, investigation of efficacy of natural products in treatment and prevention of chronic diseases. The way I can complete my mission is through the following methodology. Investigating the efficacy of natural products in treatment and prevention of oral mucositis in cancer patients, and investigation the efficacy of Manuka honey in chronic rhinosinusitis. My first topic is investigating the efficacy of natural products in treatment and prevention of oral mucositis in cancer patients. As a background, cancer patient is the second most cause of death worldwide. Oral mucositis in 40 to 75% of patients undergoing chemotherapy and 90% of patients getting chemoradiotherapy. And there is no effective tool or gold standard to prevent or treat oral mucositis. Natural products like honey, curcumin, and chamomile might be promising for prevention and therapy of oral mucositis associated with the chemoradiotherapy. My clinical question: do natural products treat or prevent oral mucositis in cancer patients receiving chemoradiotherapy? My population, it includes two subgroups: cancer patients diagnosed with oral mucositis after chemoradiotherapy, and second one, cancer patient without oral mucositis requiring chemoradiotherapy. My intervention: natural products like honey, curcumin, chamomile, control, placebo or active control. And my outcome, it includes two subgroups. The first one, therapy, symptom severity, prevention, incidence of oral mucositis. And my hypothesis: natural products are effective for the prevention or treatment of oral mucositis in cancer patients receiving chemoradiotherapy. And my clinical implication: natural product can be used to prevent or treat oral mucositis associated with chemoradiotherapy. As you can see in this slide, my final search key and databases. Per our selection, number of articles before duplicate removal is 9,378, and number of articles after duplicate removal is 6,949. And my title abstracts, it's 90% completed. And my second project, it's investigation of the efficacy of Manuka honey in chronic rhinosinusitis. As a background, chronic rhinosinusitis is one of the most common chronic diseases affecting 14% to 16% of United States population. The standard treatment for CRS include medical therapy such as oral antibiotics and steroids and endoscopic sinus surgery. Approximately 6 to 10% of CRS patients remain symptomatic despite medical therapy and multiple surgeries. Manuka honey has significant antibiofilm activity against ROS and MRSA and Pseudomonas aeruginosa. And Manuka honey alone may be effective for CRS. My clinical question, does Manuka honey treat chronic rhinosinusitis? My population patient with rhinosinusitis, intervention, Manuka honey, control, active control, outcome 22 item, sinonasal outcome test score. And my hypothesis, Manuka honey is effective for treatment of chronic rhinosinusitis. And my clinical implication, Manuka honey can be used to treat chronic rhinosinusitis. As a summary of investigating the efficacy of natural products in treatment and prevention of oral mucositis in cancer patients, and investigation of the Manuka honey and efficacy in rhinosinusitis. Thank you so much for your attention.
Thank you for your presentation. I'm Isabel. I would like to know how you are going to evaluate the curcumin and also the chamomile tea. How are you going to compare the effectiveness of these both interventions? Because we have some nutritional interventions, for example, for the cancer patients to put some tea in the mouth, inside, and how are you going to compare these?
Thank you so much for a great question. Basically, for honey, so we have different kind of honey, but we are going to use the Manuka honey. Is basically the difference between Manuka honey and other honey is like the source is coming from a specific plant. And the way we, sometimes we use a placebo, but the active ingredient for curcumin sometimes we use as a spray or as a drop. So based on different article which I checked, so we have two different groups, so placebo or control group. So and then we're gonna check like the results. So if we use a placebo, was it effective, or the control group, was it the effective or not? And we're gonna compare the result basically, yeah.
And I was wondering about how they administer this curcumin. Is it in tablets or is it a paste?
Yeah, drops. Sometimes drops. It's tablets. Yeah, it's different kind of. Yeah, I mean, based on the different article I checked, so it's tablets, drop, spray.
Okay, thank you so much.
Yeah, of course.
Hi, my name is Anna. I was wondering, doesn't it narrows the spectrum of your second review that you are investigating only Manuka honey, Manuka honey? Sorry.
One more time, please repeat your question.
So isn't the scope of your review is too small because you are only investigating the Manuka honey and not all kinds of?
Actually, my second project, it's just general idea, and I'm at the beginning of the preliminary research. So just the reason why I the second topic with Dr. Deju, because it still is natural products, and so that's why we combine it. So our clinical question as we are going to check the efficacy of natural products. The first one was in the oral mucositis in cancer patient. But the second one, we are going to investigate the efficacy of Manuka honey in chronic rhinosinusitis. So basically, yeah, just the Manuka honey these days has a lot of good reviews because this, as I mentioned earlier, it's coming from a special plant in Australia and New Zealand. So, and a lot of research, it shows a lot of seriously good improvement for wounds. Even for you have a sore throat, even for COVID, it helps a lot if you have 1 spoon Manuka honey per day. It helps a lot, yeah.
Thank you for the presentation. Of course. My question is maybe early, but what is your intuition or what the idea about the prevention or treatment of oral mucositis? Which in which case do you think natural products are more promising?
Thank you so much for your question. So based on our last data extraction, we had like I would say almost 60% of our articles it shows to treat, and 40% it was prevention, and in between some of those was just both. So it's basically we are trying to figure out based on our data extraction to which article it shows for prevention and treatment, and so as I say, most of it is for treatment, and just in between there are some articles it shows for both of them.